My name is Felix Magala. I am an anesthesiologist, and I'm here representing Mbarara as a site. I work directly under Dr. Joseph Chwanka, who is the site lead. So I'm representing him here. I'm here just to give us a little bit of what happens in Mbarara in terms of the registry. We are privileged to be one of the very first sites that has been taking part in the ICRU. And like I mentioned, under the leadership of Dr. Joseph Chwanka, but then also most importantly, with a team of data entrants. That's Carol and Grace, and like you also, they are online. Though like Dr. Cornell mentioned, probably doing both the clinical aspect and trying to be part, that's why they're not here. Yeah, from the introduction, I realized that we are an international group here. So that's why I decided to give us a brief overview of Mbarara to just know partly what happens and where it's located. So it's the Regional Referral Hospital is a tertiary institution, and it's located in southwestern Uganda. And in that region, it's, I could say, the biggest hospital. So it has the biggest catchment, both from the western region, the southwestern region, and also from the neighboring countries, Rwanda, DRC, to mention, but a few. But then also, most importantly, it's a teaching hospital for Mbarara University of Science and Technology. So everything just works hand in hand. And in terms of volumes, like I mentioned, it's being a regional catchment hospital, the volumes are quite big. And like we can see, annually we have approximately about 120,000 outpatient visits. This data has ever since changed over the years because of the increase in services that are provided and also increase in the specialists that are in the unit. And then also having quite a number of inpatient admissions. Why am I giving this information? It's very vital for our registry and also for the reason why the ICRU exists, because you're going to realize that the patient numbers in regard to the ICU capacity is very interesting when you look at the ratios. Yeah, so after understanding the volume of patients annually, I would love to mention that the hospital has an 8-bed capacity ICU, and we'll know that this is a mixed ICU. We handle both pediatrics and adults, and then also both medical and surgical cases they are in. And then also 8 major operating theaters. And also, as I proceed with the presentation, you understand why I'm mentioning the theaters. I just tried to get us a bit of an outlook of how the ICU is. Just a few really pictures, but I'll explain them for us to understand. So it's an 8-bed capacity ICU, and the setup is just like you can see in the images. Every patient has their own room, sort of like an enclosed setting, like you can see in this. So this is how every room is, and there are 8 of those. And inside the rooms, it's a setting such as that. So being an 8-bed capacity ICU, of course, the capacity to have all the 8 patients on board changes with the functionality of equipment, a few of those other dynamics like we all know. Yeah, this is also just to give us an outlook of basically how the unit seems like. So we have 4 rooms on that side and 4 rooms on this side. And of course, the central monitoring unit. So this, as a hospital, I mentioned it's a tertiary institution and also a teaching hospital. So because of that, it's privileged to have a couple of specialties that come in to work hand in hand with the anesthesiologists. I point out basically neurosurgery, a bit underlined, also because of a particular reason that I'm going to share as I proceed when I get to a few slides that have the dashboard concerning Mbarara. So this is the most important slide for this presentation, so I'll draw attention to it. And I'm just trying to share the impact that the ICRU has had towards the ICU in Mbarara and towards the functioning of the ICU. One has been improving data collection and monitoring. Before the registry started in Mbarara as a hospital, of course, there was data that the institution had, but most of this data was in words. You didn't have anything to point to. But right now, at least there is figures attached to it, and you're able to, when you log into the registry dashboard, you're able to see what activities are happening, and that is why I'm able to actually stand here and mention to us that you can know total admissions in AR, at least for the ICU, what conditions are the patients having, but then also most importantly, the ICRU has enabled our ICU to be able to you can benchmark against other ICUs, the functionality, how we can able to compare our functionality with all the other ICUs. And for those that have been able to access the dashboard, you know that there's always how data is set out is you look at your ICU and then other ICUs. So you're able to compare and know how systems are working and how you're doing. And that sort of like helps you to determine areas of improvement. And of course, most importantly also is monitoring severity of illnesses and patient outcomes, also or being able to predict outcomes of the patients. This also is embedded within the data that actually is collected in this project. Most importantly, identifying major disease burdens. Now, this I'll talk about why I underline neurosurgery. You remember in my previous slide. For example, for Mbarara ICU, you realize that actually most of the patient inflows is from theater. Okay, that's why I mentioned that about the number of theaters that we have, and also the different specialties that actually function with the theater. So most of the patient inflows comes from theater, just like this slide will indicate. You may be able to see, but this is just part of the data that we were able to use as a site from the registry, from when you generate the PDF and download your data as an individual ICU. So for Mbarara, this may not be so clear, but the operating theater actually feeds the ICU much more than different other units. And when you look at all the other ICUs, it's actually something that is similar or around. Yeah. And then also, so neurosurgery is one of the disciplines that actually feeds most of the patients in the unit. And one of the reasons we think is because, of course, being a catchment hospital, like I mentioned, the large catchment area, most of the neurosurgical cases will end up being referred to the hospital. And most of them definitely come in quite late because of the distances. So you find that the patient comes in, they have the surgery, but they'll need really ICU to enable them in their recovery. And the different other impacts, for example, supporting quality improvement in the ICU. As Mbarara, what we do, we always have, we've had about, initially we started with one evaluation meeting a year, then we went to 2, and in these meetings, we sort of like this, so we generate our data. And it's from this point that I want to appreciate the IT team, Herbert, because we always, and the leadership, because we always get in touch to make sure that we have data for the site, and this data is discussed with the ICU staff, okay? And of course, the hope is that this will be able to identify gaps and sort of like find ways to fill the gaps. So the registry in itself, for example, there's a point that one of the data entrants actually raised an issue of how come we're not having, the clinicians are not setting target trusts for the patients, okay? But how did she come to find that out? It's because of the data that is collected. And from that, we're able to encourage different clinicians, you know what, when you're doing your reviews, have a target trust. Have your rust, the patient has, but then also have a target trust. Things like DVT prophylaxis. It may be easy, it may sound weird, but it may be easy to actually make your management plan and forget a few key areas. But now for us as a site, it's from the registry data that we're able to identify those gaps that maybe we're doing bad in terms of percentages. Just to try and wind up because of time, I just put a few slides to sort of like give us a bit of how we're able to generate data as a unit from the registry dashboard. Things like knowing the reasons for ICU admission. And like I mentioned, of course, neurosurgery for us contributes quite a bunch. When you compare to other ICUs, when I was checking, this is data from 2025. So this, we got all our 2025 data. And from most of all the other ICUs, I think it's sepsis that comes as number 1. So we're able to identify some of the differences and maybe find reasons as to why. And of course, I mentioned things like target trust. So when that was identified, this graph basically shows us how we're doing this ICU, that's Mbarara, compared to all other ICUs. And from that, we're able to generate areas of improvement, discussions with clinicians. The plan is to actually have 3 monthly meetings. So we generate our data, and every 3 months we discuss and see progress. How are we moving? Yeah. This is also in terms of spontaneous breathing trials. There are so many aspects, like we all know, that we can generate from this project to actually guide improvement in our ICUs. Yeah, so from this point, I would love to still acknowledge the leadership of the ICRU. Thank you so much for bringing this project, because as Mbarara, it has been of benefit, like I've mentioned, in terms of quality improvement, and definitely also the